All right, welcome everyone to the virtual premiere of Crisis Materials. Crisis Materials is a short film that is part of the Vital Health Initiative that was created by myself and my friend, artist and educator Stacey L. Kirby. And tonight we're going to see that virtual premiere, and we're so glad that you're joining us. We're going to have more people popping in at any moment, and I'm so excited for this. Stacey has been an amazing collaborator and co-producer on this project, and you'll get to hear from her in just a moment. We are live on Zoom and on our website, ourvitalhealth.com. So share on your social media. Tell people to go to ourvitalhealth.com and they can join in this conversation. Vital Health is an interactive art initiative that helps address mental illness and the social unrest in our communities. And we all know that 2020 has been one of those years. And to do that, we've been using performances, workshops, installations, and we've just done a lot of great things with a lot of great community members across the state and even all the way in Australia. And so Stacey will talk more in detail about that. Crisis Materials is performed by Johnny Lee Chapman III and Anthony Otto Nelson Jr. It's an original poem that Johnny Lee Chapman III wrote, and it features original movement and choreography from Anthony Otto Nelson Jr., also goes by AJ. And it looks at COVID-19 and the social unrest and all of those elements. And so we're excited to share that with you tonight. We're grateful for our partners in this initiative. Tonight's event has been sponsored by the Dorothea Dix Park Conservancy. Super happy and thankful for them. We've also had partners in the National Alliance on Mental Illness, the Wake County chapter, Anchor Light, Seek Raleigh, the office, which is an initiative from the Office of Raleigh Arts, the Durham Art Guild, which is where Stacey and I are broadcasting live from tonight, and of course the North Carolina Museum of Art. So we're super, super thankful to all of them. This is going to take about an hour tonight. And so as you probably read in the literature, we're going to have some discussions and we're going to learn some things and share some thoughts. And we encourage you to, in the chat, talk to us, give us your thoughts on what you're hearing, ask any questions of our practitioners. We would love to interact in that way. So we're going to have a message from NAMI, the Wake County chapter. We have the executive director, Annie Schmidt, who's going to give us a message as we begin. We're going to have a brief history of the Vital Health Project, and then we're going to have a brief history of Dorothea Dix Park with Grace and Simone, who's a senior planner from the city of Raleigh. And then we're going to have a discussion about COVID-19 coping strategies, and then one about the effects of past traumas with our practitioners. And then we're going to have that virtual premiere. And so again, we're all are just excited for you to be here. Please share on your social media the link, ourvitalhealth.com, so more people can join in this dialogue. So before we begin, let's hear from Annie Schmidt. Annie?
Thanks, Mike. Thank you for having me here today and for partnering with NAMI in this project. I'm only going to speak for a few minutes, but I first just want to make sure everyone just takes a deep breath. We've made it this far in the week. So Mike came to me in April with this idea of putting together the Vital Health Project and wanted to know if NAMI would be on board with it. And I was excited right away. We didn't have the exact statistics about how the pandemic would affect mental health, but we knew it wasn't going to be good. We knew that people would be isolating. We knew that they would be losing work. We knew that you would be losing family members, loved ones, friends, colleagues to the disease. And you knew that people were going to be isolating and not doing what they normally do to help with their own mental health and coping strategies. And as we found out throughout the pandemic, that was true, that suicide rates went up, that substance use overdoses increased, that on average 4 in 10 adults are living with depression and anxiety symptoms as we speak. But what is so important about this project is that art plays that crucial role to healing. And what I loved most about this project was that not only were you learning coping skills and mindfulness as you were making the flowers in the process, that you were learning ways to help process all of the emotions that you were feeling. But at the end, you had this symbol of strength and beauty and that's really what has also come out of this pandemic, that there's a lot of awful things that are going on, but with the Mr. Rogers quote of looking for the helpers, it is not hard to see how ordinary people have made a difference by doing something small and turning it into something extraordinary. And this is just one example of how that all works together. And so we are very fortunate for this partnership. I brag about it to whoever will talk to me about it, because I think that this is just such a great opportunity to mix all of that together: healing, coping skills, processing these emotions, and art, as I mentioned, being an essential part of the process. So with that, I will kick it over to our artist, Stacey L. Kirby.
Thank you so much, Annie. Thank you for your support and your kind words that you just shared. There's no way that we could have done this project without you and NAMI's support. So much gratitude to you. And I am Stacey Kirby. I'm a co-creator of Vital Health with my friend and incredible creative Mike Williams, and I'm really honored to be collaborating with him. It's been about 6 months now, and it's been a wonderful journey. And just insight about me: I'm a performance and installation artist. I'm originally from Raleigh, and I'm based in Durham, and I create interactive performance art that engages people in dialogue about citizenship, identity, and human rights, and you'll hear a little bit more about that later. But I wanted to give you a brief insight into the beginning of Vital Health. We started, well, both Mike and I started projects in 2019. We created works that were performed on the land and now referred to as Dix Park for Seek Raleigh, which is a site-specific art installation and performance art event. And Mike's performance piece focused on the history of enslaved people on the land when it was known as Spring Hill Plantation, home to one of the founding fathers of the city of Raleigh, and at least 61 slaves that we know at this point. And my performance work at Seek focused on the existence of Dix Hill Asylum, or Dorothea Dix Psychiatric Hospital, as it is known. And I was drawn to the personal histories and lived experiences of the mental health patients, their families, and the staff at the hospital. And this is where Mike and I's work intersect, where we're both drawn to revealing and acknowledging the untold histories of people and the land, making the invisible visible, if you will. And for me, it was very impactful to make the connection that the enslaved laborers from the plantation built the foundation of the original hospital building, a hospital that would not even admit them as patients. And it's important to note that these histories bleed together and that they are not separate. And I grew up in Raleigh not even knowing it before Mike's piece that Dix had been a plantation, which is the case for many people in Raleigh. And these are the personal histories that can so easily be overlooked as Raleigh continues to grow as a city, and this happens on cities across the country. So as I'm gaining insights and into research in 2019 for my work, I found myself at Dix Cemetery creating flowers from silver thermal mylar blankets that I had been using in my performance work. And this material is used in crisis situations to offer warmth. And I wanted to transform this crisis material into something beautiful and bring them together collectively into wreaths in acknowledgement of these personal histories, and then over 950 patients buried in layers in the cemetery, and some graves are not even marked. And then also the families of the patients, and honoring the hospital staff and the enslaved laborers and the indigenous people of that land, and honestly anyone that the hospital served. And so I integrated these wreaths into my piece at Seek, and Mike saw the wreaths and had a vision, and we came together and thought, well, we could bring people together in community workshops to create these flowers and wreaths while sharing the complex history of Dix Park and discuss the importance of mental health with a mental health practitioner. And then of course, Mike, as he does, decides, oh, we should collaborate with a poet and a dancer and create a film and have a live performance, and just the visionary that he is, and thus Vital Health was born. And then of course, the pandemic hits and we can't come together in person. So we go virtual, and I start cutting and mailing materials to people during stay-at-home orders with my trusty assistant, Sweet Pea, my cat. And we facilitate the first phase of workshops with an educator and mindfulness practitioner whom you will meet later. We refer to her as Dr. K. And while we were facilitating the first round of workshops, George Floyd is murdered and social unrest increases in the United States. And of course, COVID-19 is taking hold at the same time, and research starts showing the increasing impact on Black and Brown communities throughout the United States. And at this point, in June, Mike and I come together with our collaborators, socially distanced at Dix Park, to create a film, which you'll get to experience a bit later tonight. But it was really such a powerful, timely, creative project that you'll be experiencing. But then we decided to continue with these flower making workshops and shift our focus to dive deeper into COVID and how it's affecting the Black and Brown communities, as well as the impact of past traumas, with guidance from trauma therapist Simone Jacobs. And let me say, it has been an incredibly insightful journey, and you'll be experiencing a lot of that this evening. So since May, we've facilitated 17 workshops, had over 380 households participate from as far away as Australia, cut and mailed over 10,000 pieces of Mylar and cellophane with the incredible help of my creatives in our community. Thank you so much. And participants have created over 4,000 flowers, of which we displayed 20 wreaths of 800 donated flowers at NCMA at the North Carolina Museum of Art this fall. And we'll be displaying more wreaths in the spring of 2021 at Dix Park before the live performance. So here we are in December, still in a pandemic, still experiencing collective trauma, still unpacking racial injustice, and thus we continue to dive deeper tonight by sharing this discussion and film with you. So thank you all for being here, and I'd like to kick it back to Mike to start a discussion.
All right, thank you, Stacy. And you know, that history is that's just an abbreviated history. We certainly have a lot more that we could share. Let's bring in Grayson Simone from the city of Raleigh, because I want to talk a little bit about the history of the park, the land. So Grayson, thank you for doing this tonight. Let's go back as far as we can go, and let's talk about the indigenous population. What do we know about who was here in the mid 1500s?
Hi, thanks for having me. It certainly is exciting to join you all in this project. So if we go back kind of as far as we know that there were indigenous populations on the site. This is one of the lesser known pieces of history that we have information on. So prior to it being a plantation, we know that there were, we think there, and it's pretty well believed that there were indigenous populations. And then, as Stacy mentioned, the Spring Hill plantation predates the mental health hospital. And then from there, the mental health hospital was established in the 1840s.
Yeah, so let's talk a little bit more about the indigenous population. Though there was a land blessing earlier this year at the park, right? Tell us a little bit about that.
Yeah, so that was a really great event, and that was put on in partnership with the Triangle Native American Society and the Dix Park Conservancy. And it was done. It was the first time in Raleigh's history that a land acknowledgement and blessing ceremony was performed. It was really great to have it out at the park. And this land blessing allows indigenous people to honor their ancestors, acknowledge those that once lived there, and carry on the traditions of respecting the land in the future.
Yeah, and because of COVID, the numbers had to be limited, but that was a very, very cool event. Everybody can go to our website, ourvitalhealth.com, and you can find the Dorothea Dix Park Conservancy Legacy Report. It's got a lot of that information in there. Let's talk about the Spring Hill Plantation and Theophilus Hunter Sr. I mean, it's so interesting to have the indigenous population, and then they're not there anymore. And then you have, you know, the Spring Hill Plantation, and we know what plantations are like. And then to have the park what it is today. So when did Theo Sr. become part of the history of the land, and what impact did he have on the city of Raleigh?
Yep, so Hunter Sr. was part of the founding fathers, if you will, for Wake County and the city of Raleigh. And he represented Wake County in the North Carolina House of Commons. He was a surveyor for Wake County. And then he did have a home that was more in what is now downtown Raleigh, but he established the Spring Hill Plantation And I believe that was in the 1790s around that time.
Yeah, he was an interesting guy. He was also the county's first surveyor and the first tax assessor. So somebody who was really civically active, if you will, but also having this plantation. And he, you know, we believe that grave that is behind the Spring Hill house is his, and it's the oldest marked grave. And he died in 1798. And so that's where the project that Stacy referenced earlier, that Johnny Lee Chapman III and Anthony Otto Nelson and I got to work on, the Will of the Father. That's where we got that from, is this guy bequeathing these souls in his will, and he's one of the fathers of the city of Raleigh. So let's talk about Dorothea Dix for a second. Who was Dorothea Lynn Dix, and why did she lobby to create the hospital?
Yeah, so some of her childhood is not that well known, but I believe the story is believed that that she did have some ill health, and she became a nurse. But she was a reformer in advocating for mental health treatment and making that a more humane treatment. So she traveled around to poorhouses and jails, and saw how people were being treated, and realized that a lot of them did have mental health. And she traveled the Eastern Seaboard to the various states advocating for the states to create mental health hospitals. And so she's responsible for a lot of the mental health hospitals that were established along the Eastern Seaboard. In 1948, she made a plea to the General Assembly of North Carolina for the proper treatment. And she also was a very big advocate for the patients to not be chained up or kept inside, but to get them outside and get them active as part of their treatment.
Yeah, you mentioned the county by county assessment she did in 1848, which detailed a lot of the ways that people were treated. And so then the state passed the bill the next year to create the hospital, and they named it Dix Hill. And the first patient obviously admitted in 1856. What's interesting about that is it's 1856. So, you know, slavery has not been abolished yet. And obviously there are African Americans who are on mental health journeys as well. So in 1880, Cherry Hospital was founded in my hometown of Goldsboro. So it's just a really, really interesting history. So let's talk about this as we close. When did the hospital officially close? And, you know, what were the reasons, and where did the last few patients go?
Yep. So the Dorothea Dix Hospital closed. The last patients left there in 2012, and a new hospital was built in Butner, North Carolina, Central Regional Hospital. In the early 2000s, there was a lot of conversation around the aging infrastructure and buildings of Dix Hospital and the cost of keeping up with this aging facility. And so ultimately the state decided to build a new facility in Butner that some of the patients were relocated to.
Yeah, it's very interesting to read some of that history about, you know, why and how we got to where we are. I encourage folks to look it up. And obviously the Conservancy is doing a great job of documenting and telling these stories. So let's talk about the future. What's the future of the park, and how can residents, what are some new ways residents will be able to interact with the park? Obviously we're in a pandemic, you know, so we take that into consideration, but what happens over the next few years?
Yeah, I will say one of the things that has been kind of exciting, which is hard to say anything's been exciting during the pandemic, but during the pandemic, we've seen some of the highest park usage during the week and on the weekends that we've seen since the site has become a park when the city purchased it in 2015. I think the pandemic really has shown people to take advantage of the existing open spaces in the area or wherever you live. So in February of 2019, the Dix Park Master Plan was adopted. It was done after a 2-year public input engagement that was very extensive and exciting, where we formulated the ideas for the full build out of the park. We believe it will take decades. We are just now in the first phase of that. And the first phase includes the Plaza and Play project, which is currently in design right now. If you go to the dixpark.org website, there's some ways that you can engage over that project. It's very exciting, about 18 acres, mix of plaza and play. Hopefully it will be built by 2024. Also in phase one is the restoration of the Rocky Ranch Creek. So over the years, this was what was a once meandering creek has been narrowed and is less healthy as an ecological corridor. So we hope to open that up. We're also doing some early site improvements, for instance, signage and wayfinding. It's kind of hard to navigate the site as it is now. So we are putting in some signage to help people navigate, but within that, we're also doing some interpretive signage to help people learn about the site. And then our first building is currently being renovated, and it is the Greg Poole Jr. All Faith Chapel. So it was historically called the All Faith Chapel. It was built in the 50s, and in partnership with the Conservancy, it is being renovated, and we hope that it will be open to the public around March, or we'll say the spring of next year. Currently, we don't have access to any buildings at the park, so this will be really great to have this place open. And of course, once things with quarantine start to shift, and we can really invite the public into this really great space.
Yeah, I'm excited to activate the chapel with events and stuff. We've had some conversations, so I'm looking forward to that. Thank you for joining us. I appreciate you shedding some light on some of the history of the park. If anybody has any suggestions on how the park can better serve them, put them in the chat. We're going to record all of these responses and share that data with the park. So however you think the park can be a better service to you, just put it in the chat. Grayson, thank you for joining us.
Thank you for having me.
All right. Everybody take a deep breath. We're feeling really good. We're moving through this thing. Let's talk about COVID-19 and coping with that. So if you're just joining us, you're about to see the virtual premiere of Crisis Materials, which is the short film associated with the Vital Health Project. So as we prep for that, we'll talk COVID-19 and coping strategies. Stacy mentioned our workshops. In our first set, we got to work with the amazing Dr. Kelsey Evans-Amalu. So we'll bring her into the conversation now, along with poet Johnny Lee Chapman III, and of course, Stacy. So thank you all for doing this and engaging in this dialogue. Kelsey, I'll start with you. Your work focuses on the use of mindfulness and empathy and compassion. And so when the pandemic, was first here, we were talking about how there's not a lot of literature on how pandemics affect our mental health, the consequences of pandemics. So you were making the case that we could look at like different large scale events like disasters or traumatic events like 9/11, right, 9/11. So make that correlation for us, if you will.
Yeah, what's super exciting yet also concerning is that since the pandemic started, we haven't had a lot of research, but now that we're in December, just very similar to how the vaccine has quickly come out, so has research surrounding what the pandemic is doing to mental health. So a lot of the research is suggesting exactly what Annie was discussing earlier, in that, we are experiencing large amounts of stress, anxiety, and overall psychological distress. But most of this was measured back in April to June, and we currently don't see the impacts of what's happening in these last couple months that we've been in. From what we've observed, and this has been, these studies have been done on an international scale in comparison with the United States, India, China, pretty much all the major industrial countries that are largely populated. And what it's shown is that many are not properly coping with the pandemic itself, and that people in large are experiencing continual psychological distress. So what we were suggesting back in June when we were initially starting these workshops is that we wanted to offer positive coping skills that people could interact with on a daily basis, maybe a weekly basis. But what research has shown is that even though these skills have been offered to a large populace, they're in fact not interacting with the coping skills offered. So we as a community are continuing to offer and say, hey, this is going to be really important for you to engage in, because what we have seen thus far is that psychological distress has continued, especially since the pandemic has continued for this long. So, and I'm sure that we'll talk about this later when we do talk about trauma and the continuing trauma that we're now experiencing with the pandemic overall. But we, in fact, have to keep showing up for ourselves every single day and strengthen resilience and reaching out for those positive coping skills, inclusive of art.
Yeah, and we'll talk a little bit with you about that in a moment. Stacy, speaking of, traumatic events, your work the last several years, I would argue, has sort of mirrored what the world has been going through. And so I'm specifically referencing civil presence. When you literally take people through what you call a performative interaction about citizenship, identity, and human rights. Talk a little bit about that and how that project offered folks a window and what it was like for certain people in our country.
So just to give you an insight into civil presence, this is an interactive performance piece where I create a bureaucratic office art installation where civil presence officers walk participants through an assessment of their civil presence. And this involves an interview, body measurements, postures, a dialogue about assimilation, which can create a bit of discomfort. And this piece also includes a period of time for written reflection as people are wrapped in silver thermal mylar blankets. And participants are then fingerprinted and issued a civil presence tag, paper tag, noting their assessment results of absence or presence. And then they wear the tag upon leaving. And all handwritten responses are mailed to public officials who impact immigration and citizenship policies in the United States. Now, there are many more layers and complexities to this piece, and you can see a video on my website. But I created this civil presence piece for an exhibition in 2018, and the prompt was presence and absence. And I was thinking about the liminal space that people in communities of color, BIPOC communities are forced to exist within between absence and presence. And our economy is built on the backs of hardworking people of color, and they are expected to show up to work, to support the economy and be grateful for having work. But dare they complain about anything, including the mistreatment that they experience, the lack of compensation, the harm, the trauma, etc., that is being inflicted upon them by white supremacy in this society. So essentially, we are asking them to show up and be present, yet be silent and be absent. So vacillating between absence and presence. And at the time of creating this piece, I was working with a Latinx youth named Jennifer as a creative mentor for 6 months. And I learned so much from her about her family and how existing in this liminal space impacts her, her family, and her community. And for 2 hours each week, I actively listened to her sharing her lived experiences, hearing stories about her family and their experience entering the United States and how they're treated daily. And even her own struggles in the education and the healthcare systems. And these issues are not new to me, of course, but hearing Jennifer's lived experiences weekly directly from her, paired with seeing security footage of people in detention centers being wrapped in mylar blankets and families being separated, all dehumanizing and causing trauma. Add in the rhetoric and hatred of othering used by the US president and other politicians. This really drove me to create this piece and to use performance as a tool to push at the bubble of white privilege and advantage and the ignorance that comes along with that, including my own. So in civil presence, I reflect upon immigration policies and the history of race in the United States. And because this is an important time to listen and reflect and do our own inner work and find ways to contribute to transformation through building relationships. And this is what Mike is continuously pointing out, and one reason why I'm so grateful for working on this project with you, Mike.
Well, I got to say, in watching civil presence and watching the mostly white people participate, and then seeing on the news these Latinx families going through all these things. I mean, it just blew my mind, because now they get a window, these people at your performances get a window, even though it's not the same, but they're forced to do some introspection, which is the work that we do. And Lee, you know, that's the work we've done now for, I don't know, 5 or 7 projects. I can't keep up. So let's, you know, we're talking about traumatic experiences, and we understand that Black Americans have gone through centuries-long inequities that add up. And then here comes a virus, and we haven't seen this in 100 years, a virus like this. And so in the film we're going to watch in a few moments, Lee, Crisis Materials, I mean, you wrote this original poem, and in the typical Lee fashion, you pull on a lot of strings, a lot of things about our hearts. But in it, you ask a series of questions. And this is what you say: the melanated mind, what weighs on it? What is vital to our health? Who is essential? What is it that allows our trauma to spread like a sickness? And so I want to ask you this: how has writing and creating these last several months during the pandemic and the social unrest helped you with these things that, as you ask, are weighing on your mind? How has the art of all of this helped you?
Right. So when I think about art and my relationship with art, what I realize is that art is an experience. You know, it's you experience something in your life, and then you as an artist try to make sense of it, and you making sense of it is the product. It is a painting, it is a poem, it is, you know, whatever that production you're creating. And you utilize this experience to just really shape your perspective on things. So for me, when it came time to like writing this piece specifically, to have such varying contexts, such varying elements, the social unrest that we're dealing with because of George Floyd, Ahmaud Arbery, Breonna Taylor, like these names that just came about in 2020 alone. And these are names of a list that is extremely long that we've been adding to ourselves almost monthly, daily at a time. You couple that with this global pandemic, like you mentioned, that none of us have lived through before. So it's all brand new. It's an experience that we're all taking globally. I mean, when's the last time a global situation has happened where the entire world has had to stop and chime in on one specific thing? That's been a rare occurrence. And then you take that and you layer it with this history of Dorothea Dix, which is a mental hospital. But then you come to find out that before it was a slave plantation, and before that it was you know, populated by indigenous populations. But then as you're uncovering the histories of each of these, you realize that each of those layers has its own set of things. So for example, in the piece, to talk about 950 patients who were buried underneath this cemetery, and you don't even recognize the cemetery when you go to the park. Like, you have to actually actively seek it out. And then when you get there, you're like, I don't see where they could have buried 950 people in this land. So taking all of this, 3 completely different things that on their own probably require at least manuscripts and full dissertations just to unpack. The beautiful thing about art is being able to compartmentalize all of these things into something that's tangible. It's taking my experience as a Black man in America, looking at the history of Dorothea Dix, being a healthcare provider as a dental hygienist, and realizing what that effect has on what kind of issues that a pandemic brings to the healthcare people, and then looking just at my normal lived experience as having to all of a sudden go from being a performing poet to now sitting at home almost every single day. Like, these things were so varied and so strange to have to wrap my mind around. If I didn't write these poems, if I didn't create this, then I don't think I'd be able to provide myself perspective of what's going on in the world. And you take that and you layer it out on top of it, and you say, I don't just want to provide myself with this understanding. If I have the ability, why can't I pass it on to the person next to me or somebody I interact with on a social media aspect? Like, it's more than just the individual that the art is designed for. It's for the community. So to be able to talk to a community with just words that were written, you know, at the end of the day or at the beginning of the day, it was for me. But by now it's realizing that this message And this experience that I've been going through is something that everybody can relate to, and they can take a piece of it and then start to make sense of their own stories, because that's the goal at the end of the day.
Yeah, that's one of the, and we'll talk about this a lot, one of the most beautiful things about art, man, is that, we can put these things out there that we are going through. And when we get into the discussion with Simone, Lee, and Myra, we'll talk more about that. Kelsey, I'll come back to you. Lee and Stacy offer us a way through art, as Lee just said, to cope and manage. But going back to these strategies that you said that the data shows that people weren't using. Why do we have the tendency, we as a collective community, have the tendency to reach for coping mechanisms that aren't healthy?
So what was really interesting is I've looked at the research and looked at it at the larger scale, but having collected data at my university that I'm a professor at, I was able to really examine closely the college students and how they were reacting to the massive amounts of changes that were happening in the spring. So that's what we collected the data in spring of 20. And even though we offered them mindfulness coping strategies, a very specific program, they did not engage in the program. And a lot of this is attributed to that when we are in periods of stress and specifically trauma, we tend to go back to tools that we think that serve us due to a lot of how our brain is just it's how it's formed, where we establish neural pathways in our brain. And when trauma hits, we're more apt to go back to something that is familiar rather than try on something new, which can also lead us to just uncertainty. So the human brain doesn't like to not know something. So when we offer a new tool, especially in a time of trauma, or a time of extreme stress, a lot of the times that human is not going to engage in it. So it makes a lot of sense why that was occurring. It's not necessarily the best, but we have to, the biggest thing that I tend to see is that when humans are more resilient, they are more apt to engage in something that is unfamiliar to them. But a lot of the times, resiliency is not, again, the first thing that you go for. You're going to go for your most basic needs first, over choosing something completely different that you're, again, unfamiliar with. So if you're looking at the population of people that were less apt to engage in coping strategies, positive coping strategies, when we looked at gender specifically, females were more stressed than males. And that is a very general trend, and that is not specifically isolated to the pandemic. That trend is been on par even outside of the pandemic itself. So a lot of that would be contributed to stress that they would experience on a daily basis. So if you look at what's happening during the pandemic, it reflects a lot of the trends that were happening even prior. And again, I would suggest that in order to move towards a more positive coping tool, we have to have community support. And I'm grateful for NAMI specifically for this reason, and a community of like-minded people that we have on this call tonight, because otherwise it's going to be a lot more difficult for a human to be resilient by themselves.
Yeah, and some of those top strategies you sent me, watching television for entertainment, social networking, and we know that the more we watch these incidents happen on TV, for a lot of us, myself included, I can only speak for me, I suppose, our anxiety goes up. So that's not, a really, really good habit. Stacy, if we talk about some of these workshops that we've done, talk about the process and why you felt that flower making would be a therapeutic way for us to release some of this anxiety.
Well, as I mentioned earlier, I came to this flower making practice from a place of reverence for those that have come before us at Dix Cemetery. And I found that for myself, sitting in nature, the nature of the cemetery, and repeating this simple practice with my hands helped me connect with a sense of calm and inner quiet. And this is kind of the blissful state that I often experience in my yoga and meditation and art making practices. And so coming back into the body can release the emotions that arise within us and allow them to flow through us. And as humans, we spend a great deal of time struggling with complexities and stresses of life, and I know that I do, and these manifest in anxiety, depression, anger, grief, sadness, and so on. And maybe some of you listening can relate to that. And then you add on the layer of the pandemic and restrictions, and the suffering just increases. So I started identifying that my pre-COVID practices that helped me center me were no longer available, or as Dr. K was saying, familiar practices just didn't have the same impact as they used to. So integrating this flower making practice into these vital health workshops, which I purposely kept simple and easy, was a way for us to come together and take part in a calming practice while reconnecting with our physical selves, and even via Zoom, which also helps balance out the intensity of our discussions that we have around COVID and trauma. And we actually really need more embodied practices, given that we are spending time on technology, staring at screens, trying to connect with one another. And these physical practices help us remember that we all have bodies below our shoulders, beyond the rectangle of Zoom. You can actually look down and look at your body if you want to, it's still there. Yeah. And of course, not all practices, of course, are calming for everyone. And we always honor that in vital health workshops. If people feel compelled to just listen rather than make flowers, then so be it. And after the workshops, the people can display the flowers in their homes and during stay-at-home orders, or share with loved ones like your daughter did with her grandfather, Mike, or mail them to someone that they love, or just mail them to be part of the vital health wreaths for future installations. And honestly, this gives people an opportunity to be part of something larger than themselves during this challenging time, which I think we all need. And I felt this way as I was making flowers at Dix Cemetery. And I also feel this way taking part in vital health, as if I'm acknowledging and contributing to something greater than me and connecting me to a larger community. It is extremely therapeutic.
Yeah, and I want to go back to Kelsey for a second before we get back to you, Lee. So we have a comment in the chat about how mindfulness can be difficult for people with trauma experience. So Kelsey, respond to that.
Yeah, and I really appreciated that statement, because a lot of the research now has, just within the past 5 years, has shown that certain mindfulness techniques, dependent upon the trauma that you've experienced in your past, may exacerbate your personal and or collective trauma. So dependent upon what your personal trauma is, and I'll speak from my personal experience, that having had an eating disorder in my past, being aware and doing a body scan practice for meditation was highly triggering for me. So there's a lot of different meditative practices that are accessible from a more trauma-informed way, that are more about taking note of, where if I'm looking around outside and I'm doing a meditation practice that is trauma-informed, I would take note of what's around me, meaning like if I see a tree, I say tree, I say I see a person, and I just simply move around and take note of what's around me so I can get more embodied in that format. But I definitely wanted to address exactly what Jocelyn was saying, in that dependent upon even breath work, especially with now what happened with George Floyd, breath work can also be traumatizing dependent upon your personal experience and what might come up in that. So I would highly suggest doing this with an informed practitioner of mindfulness and also a therapist.
Yeah, thank you for that, Kelsey. And the research that you sent that had the top 7 coping strategies that might not be as helpful were as follows: watching television for entertainment, social networking, listening to music, sleeping, doing mundane house chores like cleaning and washing, eating well, and clearing out and finishing up piled up work. So that's interesting. Lee, let's bring you back in here as we wrap this up. We know that this virus, COVID-19 affects BIPOC people at higher rates as far as hospitalizations, as far as death, and as far as cases. We know that. That's what the data shows. We can't deny that. And in the poem, Crisis Materials, we're going to show that film in here just a few minutes. You write this: it's an invisible illness that is exposing the minority population to a psychological pandemic, pulling down the foundation. Briefly, if you can, break down what you're saying there.
Yeah, so, I mentioned my previous healthcare experience as a dental hygienist, and growing up and realizing, working in this field, you realize there's a natural distrust between the African American community and Western medicine. And if you go back to the origins of that distrust, you see that it's there for valid reasons. When you think about the Tuskegee experiments that happened, or even if you think about the history of gynecology and where that kind of study of life came from. Well, medicine has utilized Black bodies as experiments for the sake of, getting a product for white bodies. So when you think of something like that, and then you couple on this pandemic, which the pandemic didn't create this gap. All it did was pull the veil and start showing where all the cracks in the foundation were. And when you look at that, you look at the disproportionate numbers where you ask yourself, well, why is it that Black people are getting infected more? Well, look at, the socioeconomic status. When a couple months ago, it was stated that Southeast Raleigh, the area that I used to go to high school at, an area inside the city of Raleigh, had one of the worst cases in the entire state of North Carolina for COVID-19. And these are the people who run the trash, who are mail and postal workers, who don't have the luxury of working from a digital space. They are also those front lines. So to go in and you think about this nature of essential, well, you could almost substitute the word essential in some aspects for minority. And when you look at that, you start wondering like, okay, well, if we just call them essential, but then we don't give them the same benefits and acknowledgments that we would for some other workers. All it did was just show us how much we've had to suffer for the sake of this nation to stay afloat, for the sake of people to be able to live comfortably, for people to still be able to, engage in certain like capitalistic practices, like just going out and shopping on a weekend. Well, all these things, the basic layers of society are still being run by people of color. And if you think about the line, the foundation being pulled down, well, if in military tactics, divide and conquer, that is how people take over a country. They split the people up. And if it's a smaller number, you're easily able to take over. So when you think about what's been happening in America, and this isn't just because of the pandemic, this is also the political sphere that we've been dealing with. But when you realize that we've been systematically breaking up America into smaller groups, these small groups, like the African American community, the Black community, if they go down, the foundation of the nation goes down. If they go down, the next group goes down. When the next group goes down, the next group goes down. And it just forms this domino effect that eventually leads to what? A nation that's nothing. And if the foundation goes down, well, it might be the opportunity for us to build something up. But again, it's going to take this bridging. If there's a gap that exists and we're two sides of it, there has to be a middle ground where both people can meet. So the goal of what we need to be doing in the coming years is finding a way to bridge the gap between these two groups that have a natural distrust towards each other. And it's going to take effort on both parts. It can't just be done from one source and say like, hey, we're going to extend our hand all the way out. We can't expect us as Black people who don't have the resources to all of a sudden make the bridge. Like, well, if you give us the bridge, we can do the work, but you also have to meet us halfway. So that's the goal. And I encourage people, conversations like this just give us insight. They give us perspective. And the best way to be able to change a behavior is by first changing your perspective.
Awesome. Thank you, Lee. That's going to be the last word for this portion of the discussion because we are running just a little bit behind. But I love, this is how we do. If it was just me and you and all of us in a coffee shop, this is the exact conversation we would be having. So thank you to Dr. Kelsey Evans-Amalu, Stacey L. Kirby, Johnny Lee Chapman III for your insights. We're going to transition to the next discussion, and then we're going to see the virtual premiere of Crisis Materials. But Anthony Otto Nelson Jr., who also goes by AJ, a dancer, choreographer, dance instructor, is going to lead us in a 1-minute breathing exercise as we transition. AJ, take it away.
Hello, everyone. Hopefully you all can hear me just fine. As Mike introduced me, I'm a movement practitioner. I have been dancing for 11 years now. And a large part of my mental health toolbox and a lot of where my movement stems from and my initiation also comes from a lot of the breath work and intentionality. So during this intentional meditation is what I like to call it. We all just silently say an intention in your mind, and that can be an intention on, I just need to forget how many emails I have today, or it can be, I just want to be present in the moment. It can be something that you can hold on for this moment for just the meditation, or it can be something that you try to challenge yourself to maybe take it on for the rest of your evening. Additionally, maybe you can extend it for a day, and you can hold on to this intention. And intentionality strikes something in us that starts a change and starts a transformation. So the very beginning of this, we will start just by placing our hands right here on our chest. I can invite you to close your eyes during this movement, and we will just bring yourself into the current space, into the moment, just by taking note of the information that's around you. Maybe that's something that you hear. Maybe that's a fan in your room. Maybe it's something that you see if your eyes are open. Maybe it's something that you smell. Maybe it's something that you taste. Additionally, you have this tactile sensation right here in your body if you want to connect to touch. Additionally, you have fabric on your clothes. Maybe you can feel the fabric of your clothes. Take in as much information as you can just for the next 15 seconds. And focus solely on your breath. Breathing in gently through the nose and letting things go, allowing things to drop off with your exhales. Allowing the mind to come to a quiet stillness and allow the breath to allow you to let go. As you bring yourself into the moment and into the present, to further ground yourself, silently state your intention. My intention is to be authentic and to be present and to offer healing. Silently restate your intention in your mind just for a few more seconds while holding on to just as much information as you can. Whether that's a tactile sensation, a touch, something that you hear. We're going to take one collective breath, inhaling through the nose deeply. If your hands are on your heart, you can allow them to dissolve. Let go of unnecessary tension in your shoulders. You can blink your eyes, bring yourself into the present moment if your eyes were closed. Thank you so much.
All right, thank you for that, AJ. So we're going to have you in this conversation. We're also going to enlist the help of trauma therapist Simone Jacobs, who Stacey and I asked to be a part of our second and third set of workshops because we wanted to address the social unrest that was going on and the trauma associated with all of that. Simone is the founder of a practice in Tacoma Park, Maryland called Tacoma Therapy. I have chai tea in my throat, I apologize. And she's also the co-author of a book, Understanding the Paradox of Surviving Childhood Trauma. And we're also gonna bring dancer, arts administrator, and our production manager, Myra Weiss, to the dialogue. So thank you all for joining us. Simone, we're gonna begin with this definition that you supplied me from Dr. Karina Walters about generational trauma. She says this: an event or series of events perpetuated against a group of people and their environment, namely people who share specific group identity with genocidal or ethnocidal intent to systematically eradicate them as a people or eradicate their way of life. And we began all of our workshops with that quote, and then this from Black Reconstruction by W.E.B. Du Bois. In it, he says this about slavery: it was part psychological, the enforced feeling of inferiority, the calling of another master, the standing with hat in hand. It was the helplessness. It was the defenselessness of family life. So Simone, as we have talked about several times, when slavery stops, that does not mean the trauma stops. So break down why it's important for us to understand the weight of these past traumas.
Yeah, so you said it already, that basically when the trauma stops, we then have to deal with the consequences and our responses to the traumatic experience. So, you know, trauma has effects on us emotionally, psychologically, physically, spiritually, like all aspects of ourselves. Otherwise, it wouldn't be traumatic. And it challenges us in some way, right? And so it challenges the way that we think about the world. And so even though the trauma of enslavement stopped, the consequences of those ongoing intergenerational from one generation to the next don't stop. And so we tend to respond to these things by becoming depressed or becoming anxious. But the problem is the way that we view mental health often is that we see depression as the problem or anxiety is the problem, but really there's solutions to the larger problem, which is the traumatic experience. And so when we deal with the trauma, what we can recognize is that depression, you're like, well, why would that be a response or a way to deal with trauma? But what depression does and what anxiety does is they put a lid on the much more complicated emotions of grief and betrayal and loss and the excruciating pain that goes into being lives being ripped apart, attachment, security, a sense of self being all torn up from one generation to the next. Because in order to keep a group of people enslaved, you really have to tear their hearts out, which is the family, right? And when fathers cannot protect their children, mothers cannot protect their children, you take their heart out. And so that's why there continue to be long-term consequences long after the trauma. And of course, the thing is the trauma hasn't stopped. So while slavery has stopped, the racial oppression continues. And so we sort of switched out one set of traumatic experiences for another. And so the ways that we have of coping continue.
Yeah, let's put some specifics to, things continuing. So, okay, slavery stops, then we enter into the deconstruction of Reconstruction, which is Black codes, and then we get into Jim Crow, and then as Isabel Wilkerson calls it, James Crow, when you're talking about housing discrimination. So it's like every generation has something. AJ, as we were preparing for this, to shoot this film, we all talked about, everybody that's on this webinar tonight, talked about having to revisit the traumas in our own lives. What was it like going for you? I'm thinking about, as I ask that question, I'm revisiting in the moment some trauma in my own life. So give me a second. AJ, what was that like for you to be going through the process of honoring the history of the land and the people Lee mentioned that are buried there in layers in the cemetery, on top of coming to terms with your own traumatic experiences?
Yeah, I remember that experience quite vividly, just because we were still in the early processes of like conceptualizing. We were still having very, very deep conversations about intentionality and process. and also taking into account our emotional responses to all of what was happening on so many different calibers around us. And I remember at that time, I had actually just started therapy for myself. So I was already beginning a new journey in terms of my own personal mental health journey. So coupled with understanding where my own traumatic experiences stem from, and at the same time having to acknowledge what the traumatic experiences of the land, more so we can say, I believe that it triggered an honoring of both the land, the people, and also my emotions to it. And there something began to happen into that became like a catalyst for my movement. And I believe there's this parallel that began to happen, where understanding that honestly that I come from a single Black mom growing up, and also understanding that from my own therapy that my own childhood traumatic experiences has actually probably I have to, the where they stem from is from a lineage, and that is beyond me, that is also beyond my mother. So understanding that the trauma of the land and the trauma of my lineage and the trauma of my own childhood experiences, they all seem parallel to each other. And then that was, I had to make it my job to lean into my emotional responses to that. And that's where the work began to happen. And that's where I had to turn back into myself and use some of my own personal toolboxes, which was breathing and breath work. And I had to take a moment just to quiet my mind and quiet my body and really quiet the inner turbulence that was happening. So to circle back, that was kind of my process of acknowledgement, honoring, and then trying to quiet that inner turbulence. And then once I found that inner turbulence, using some of my own personal toolboxes, which was the breathing meditation, intentional meditation that we started with, that's where some information started to bubble up, and that's where it became the catalyst for the movement. And that was like the process.
Yeah, we had some tough emotional conversations. It seems like the work that you and Lee and AJ and I, you and Lee and me do, we always have these discussions. Myra, your background is dance, and so you've workshopped several spaces before, and you did that with AJ at the park. You wrote a blog post for us about that. People can read it, ourvitalhealth.com. What was different in this instance, though, considering the history of this land and the cemetery, and then what we were seeing around the country? Did that affect your approach in terms of movement vocabulary?
Yeah, I'll start with saying that I was already a big believer in multisensory approaches when it comes to gathering information on the energy of a space and land that we're working within. And really this gathering of information is actually a listening and dialoguing, like AJ referenced. I'm also a big believer in that artists are a conduit of expression and storytelling that, otherwise may not get to see the light of day. Despite these convictions, though, yeah, there's this fear with every project of, who am I to be helping and assisting, the expression of this idea or story or topic. And, it's, will I do justice to the project? So yeah, with crisis materials, that fear was exponential. We embarked on the creative process at the height of summer. So, thinking back to that time, there were social unrest on a daily basis. We were still very much in, kind of these early moments of COVID where it was really becoming clear that there was disproportionate effects on Brown and Black communities with COVID-19. And so, yeah, these current circumstances with the roots of the project, giving this reverence and paying homage to the souls buried in literal layers on the Dix Park property and in the cemetery, it became exponential, this weight, this tremendous weight, to give my own reverence to the process. So yeah, my approach, I decided very consciously that I needed to deepen this active listening. And it really took a lot of internal work, that Stacy had referenced earlier. The more work I did internally to unpack, my own traumas and giving my own reference and homage to my experiences, the more I could actually have capacity for the group. As performance coordinator or production manager, it's easy to see that as just the physical logistics. So I'm scheduling, I'm helping the producers, you and Stacy, kind of visualize the set design, coordinating wardrobe, all of that. But really what I found as we were working through the process, that my role really was, especially as a white cisgender female in these circumstances, was to not necessarily remove my voice, but to integrate my voice to be present for, to create the energetic safe space for Lee and AJ's voices to come through. And so, kind of becoming this ally and amplifying their voices and these stories, going back to being this conduit, that really was a key part of the approach.
Yeah, I love our working dynamic that our group has. We're going to move quickly here. We are going to watch Crisis Materials in just a few moments. Simone, in this film we're going to see, Lee says this. He says, "Lost our souls like soldiers who found their way into this hospital, driven to PTSD because the rebellious South couldn't let go of slavery, still latching to these participation trophies that never should have been erected in the first place." So he's referencing Confederate monuments. So Simone, in terms of generational trauma, how do these participation trophies, as Lee calls them, activate or reveal trauma?
Yeah, well, not many of us have a PTSD response to the sight of a, Confederate general or whatever. But what it is more that, like we've talked about this before, they're kind of like these monuments are like watchtowers, right? They hold up the values of the communities in which we live. And so while, like I said, there's no immediate response to this thing, when you think about it, we're being constantly assaulted on so many different layers in so many different ways. When we're told one thing, no, everybody is equal, or men are created equal, but we're being treated very differently. And so that does, it's the layering on of stress on stress on stress. From the monuments to the, to the news, to the movies, to our education system, it's so many different layers. And these are just one of the symbols of how white supremacy is promoted and accepted, right? America's supposed to be the good guy, but we have these monuments to people who did really evil things. And so this is going to affect us on a day-to-day basis, even though we might not have an immediate response to it.
Yeah, the phrase that you use that I always find fascinating is watchtowers. And just for some context for people, back in August, the Southern Poverty Law Center estimated that there were roughly 1,800 Confederate symbols on public land. Just over 700 of those were monuments. So keep that in mind. And Lee's talked about the Silent Sam situation at Carolina and other places. So these things can do damage to people. Simone, you often talk about the stress pile up. And so certainly this can add to that. I want to share my screen really quickly, AJ, because I want to read this quote from Dr. Rita Walker, who is a professor at the University of Houston, and she's written a book called The Unapologetic Guide to Black Mental Health. This is what she says, an excerpt from this. "There's some research that shows African Americans have been experiencing trauma-related anxiety in response to chronic media exposure to violent deaths of African Americans. You may be wondering how someone who is not directly or even indirectly affected by violence would have heightened anxiety. I suspect that in any one of these unharmed shooting incidents, you can imagine someone close to you who would be targeted. Each time you hear of another unnecessary murder of an unarmed person, you feel anger and a sense of helplessness. You may be saddened or enraged. In any case, they are all reactions to an awful and pervasive problem in our society, a problem that has meaningful psychological consequences. Research shows that Black people report poor emotional health for 1 to 2 months following the police shooting of an unarmed Black person. So AJ, Lee references Breonna Taylor in the piece. And of course, there's so many others. Talk about briefly, if you can, your emotional toolbox and how dance has not only assisted you in going through this, but also you've seen it help in the students that you teach.
Yeah, well, dance first, like it is a huge part of my emotional toolbox, and I love that you brought that terminology up. Another part of my toolbox in terms of like my emotions is identifying safety, and that's something I've been trying to do more actively and more recently, is identifying safety, what it looks like, what it feels like, who's there, what am I doing, what is the setting, what objects are around me, being as detailed as possible, so that when I'm not in safe spaces, I can understand how to create the space around me, even if I'm not in that particular setting, especially to what Simone was speaking to in terms of these settings where we have these monuments and you have these buildings that are named after people, and there are these spaces that aren't necessarily safe, so for lack of better terms, and so a huge part of that is understanding, acknowledging what it looks like and feels like. Another part of that in terms of safe spaces as well is how I help the community. So what I have been doing recently is I have a Monday wellness class, and we do physical wellness and mental health wellness. We have a short little check-in. I check in with my students, say how they're doing, what do you need? And I think another part of that is identifying what you need. Not necessarily what you want, and that's some of your needs, whether that's emotional health, physical health, spiritual, all of these different types of things. So it's very good to identify safe spaces, identify the things that you need, identify the things that fill you up, and the things that support you, and the things that really lift you. And it makes me feel good to have to create spaces for others, because for me, dance is a way to connect with people. And I mean, during this time, I have emotionally been suffering because I don't really have that connectivity. As honestly, even dancing through a screen, there's this barrier. So another way for me to cope with that is to connect in a different way. And I've been connecting with my community to support both myself and the community just by offering that space of healing.
Yeah, it's beautiful. And Myra, as we wrap up and get ready to show the film, the pandemic, social unrest, people are working from home if they're lucky to. They are schooling from home. There's all these things that are happening in our homes. And Simone mentions the stress pileup, as I referenced a moment ago. Why is dance such a powerful way for us to consume and then unpack all of these things? Because as people will see in the film in a moment, AJ's movement sort of offers a kind of a settling aspect to it.
Yeah, I'll say first, dance is such a powerful art form in and of itself. It exists at the vanishing point. In nanoseconds, it's happening and leaving all at the same time. And if you think of emotions as energy in motion, dance really can be a way to safely harness and release those charged energies. So long as we're here on this earth, and if 2020 has taught us anything, it's that all we have in this moment is our body and our breath. So you don't have to be a professionally trained dancer to experience the value of movement in your body, down to the time you take to blink your eyes, or the time you take to inhale and exhale your breath. All of that is dance, and it's movement. And there's an entire world of information it can provide for you. So I think I just would encourage folks to tap into that. And really all it requires is a curiosity. And then I would just invite people to, and kind of parallel to this project, really invite in this idea of reverence and homage to your own process, to your own experiences. And, like Simone mentioned, to your response to the traumas. Invite that reverence in. I think it would be a really beautiful moment to experience.
Simone, as we wrap up, I did want to give you the last word, being the practitioner. We're seeing these rates higher for BIPOC people, as we've said. How can seeing that over and over again, that you are being affected, briefly, if you can, how does that reveal trauma in and of itself, just knowing that fact?
Yeah, well, I think your quote earlier said it all, really. I can't really build on that. I mean, it's the same kind of experience when you see BIPOC people being affected more, with higher rates of COVID and with higher death rates. Of course it's going to impact you. And the thing is that what is happening now is a traumatic experience, right? Is the classic definition of trauma. We have, it's unpredictable, it's uncontrollable, there is an actual threat of death. We have lost our usual coping mechanisms, of distractions and social interactions, like we're isolated. And then to top it all off, for the longest time, we've had a bad dad. And the bad dad reference isn't like necessarily a political statement, but the parental role that is played by our leadership is one of transforming the narrative to let us know that we're going to be okay. And when we feel that we are alone, which is the experience of many BIPOC people anyway, it's like, that's why the stress pile up becomes too much and we explode. And that's why there was the unrest. And I don't call it a breakdown, it's a break in. We're trying to say enough is enough. And as black people, people of color, whatever, it doesn't BIPOC, it is, we have to stop taking care of the people that are hurting us. And so this is what we do, right? To say enough is enough.
Stacy, because as we wrap up, I just want to, get initial thoughts and feelings about what you just saw, all the hard work. Stacy, it's been 18 months, and this is the culmination of the 2020 event. So what are you thinking right now?
It's hard to have the words. It just reminds me of how art asks us to step into vulnerability. And I was honored to be behind the scenes during that filming. And I have so much gratitude for AJ, excuse me, I can't speak, and Lee's talents and their ability to speak and dance the truth to life.
So I want to answer a couple questions in the chat before we go to you, AJ. The siren was just the siren. Big shout out to Julia Wall for her work on this project, filming it and editing it and listening to me give a lot of feedback every day, every hour. Siren was just there, and it was just apropos on these projects that I've been able to work with Lee and AJ on, and Myra. Something like this always happens, whether it's a camera that just turns by itself. There's spirits around. At Dix Park, we took down a tree during a live performance, and so that was just a part of it. AJ, what are you thinking really quickly before we close?
I could probably move better than I'm probably gonna speak how I'm feeling right now. I'm feeling very, very open, very vast, but also very vulnerable too. It's always very vulnerable revisiting it and seeing it, because you get put back in that space. And I'm not saying it in a negative connotation. I'm just saying that I'm in a very self-reflective mode anytime I see any of the work, because I just know it's way larger than me. And I just hope that someone gets something from this, and they really feel like they can take something that supports them from this, honestly.
Yeah, it's beautiful. I see these things in my head, how they're going to play out before we even begin. I know what I'm going to ask of you and what I'm going to ask of Lee, and you've not disappointed, not come close to being off at all. So I just appreciate y'all. Lee, last word about this.
Like AJ said, being taken back into that place. I remember the first time I came upon the cemetery, what I did was I took off my shoes and I just walked through the cemetery. and I just walked and looked at all the names on the plaques, and realizing that we always associate things with numbers so much, but every single one of those 950 patients was a person. Everybody had their own story. That's what creates the history that we're unpacking, all those stories combined. And to be a vessel and a conduit for those stories that never were able to reach something larger than themselves, like it's a very overwhelming feeling. Like I'm overwhelmed right now just going back and watching it, but just realizing that those stories, being able to share them with the world at large, is done with an effort to make sure that it further enhances the stories that you are writing as an audience member to the art, that you are able to take something from what we were able to do, because we took away what we needed to, and our job was to just pass it on to the next person. So if one person was able to take something away from it, then we did our part.
Yeah, I'll just say a really, really tough last 7 years for me is when my mental health journey began in earnest. And this summer was really, really difficult. And this project really, really helped me come to terms with some of my own mental health things that I wanted to work through. And I just want to say thank you to Stacy, to Lee, to AJ, to Myra, to Simone, to Kelsey, to Annie, and all of our partners on this project, because this has really, really helped me. Let's close with a flower dedication that Stacy is going to lead us in, our entire group, and we wanted to share this with you.
So this is a practice that we do at the end of all of our flower making vital health workshops. So I'm going to ask everyone who's still with us, even if you don't have flowers, you can bring your hands to your heart center. I'm going to grab some of our flowers that we've made here. So what I want everyone to do is bring it to your heart center if you have flowers, and my collaborators are doing so, which is really beautiful. And just take a moment, and if you feel comfortable, close your eyes. If not, you can keep your eyes open. That's totally fine. And then bring to mind, or maybe bring into your heart someone that might need support or positivity right now that you'd like to acknowledge. And maybe it's someone that came to mind during the discussion or during the film, anyone that comes to mind. And let's just take some time to acknowledge these people for a few moments. And if you're, at home by yourself or maybe with family members, perhaps you even say that name of that person out loud. And then we're just gonna take a little moment of silence together and think about that person right now. And let's just take a deep breath together, inhaling and exhaling. And then you can open your eyes if you have them closed and come back into the room that you're in. And let's just take a moment to look around the room and connect with something that brings you joy, whether it's a color that brings you joy or an object or maybe the flowers in your hand. And just connect with that feeling of joy before you rejoin us into the virtual realm. And then I'm going to say thank you to everyone. This has been such a pleasure tonight. Sorry that we ran a little long, but we always do because we have so much to share. And I'm just going to go ahead and kick it back to Mike to close us out.
All right, thank you, Stacy. Thank you to everybody who stayed with us, and mostly everybody did. We appreciate that. Ourvitalhealth.com, you can learn more about this project. For the next 24 hours, this entire program will be up on our website, so please share with other people. You will get an email from us saying such tomorrow, so appreciate you doing that. Thank you to our partners on this project, the Dorothea Dix Park Conservancy, the North Carolina Museum of Art, the Durham Art Guild, where Stacy and I are right now, Anchor Light, Seek Raleigh, which is an initiative out of the Office of Raleigh Arts, and of course, the National Alliance on Mental Illness. Thank you so much, Annie Schmidt. This was our last activation of 2020, but look for a live performance at Dix Park next year. I don't know what form that's going to be, but we're going to do it. And we're excited about that and look for more workshops. Thank you all. And please, please have a good night. Be safe.